Hello and welcome to the first episode of LEAP's Regional Resiliency Report for 2021. This month, we'll speak with LEAP's own Tony Willis and Keith Lambert about LEAP's Medtech Advisory Group and its work meeting the moment of COVID-19 and looking ahead to the future of medtech innovation in Greater Lansing. We'll feature two members, Kirk Ray of McLaren Greater Lansing and Joe Ruth of Sparrow Health System this month, and hear a brief update from LEAP President and CEO Bob Trezise.
Hi, everybody. We have a really exciting video ready for you. Here at LEAP, just a quick report. We've been very busy with a lot of business development news. Right on our plate right now is the survival grants that we're working on. We have $3 million to distribute to small businesses across Ingham, Eaton, and Clinton County. And we are heavy working into that right now, doing reviews with over 30 volunteers. Thank you to all of them, especially Katlyn Michigan Works, SBDC, Greater Lansing Convention Visitors Bureau, and the Lansing Regional Chamber of Commerce, but so many others too who are helping us with this big lift. We have over 1,040 applicants exactly. We're heavily focusing on restaurants, bars, gyms, and entertainment venues. And we have about 400 applications from those. We can select 194 for $15,000 grants. So as usual, both a heartbreaking and rewarding kind of experience because we don't have anywhere near enough money to satisfy and accommodate all of the very well-deserved applicants. But we have a tenacious process, a very fair process, one of equitable distribution. And so we will get the job done and we will do it right in a very fast way. While that is going on, I had the real honor of attending the opening ceremony of our new round of one and all participants. This program targets entrepreneurs who have a nice startup business idea, but all participants have to be below the ALICE threshold, which is essentially the working poor threshold. And we're very excited by that. We have wonderful participants in that. We also have a very busy pipeline with very major projects that we're both attracting and expanding. We had, of course, our big announcement a few weeks ago with Shift down in Charlotte with hundreds of jobs, more than hundreds of jobs, really. But again, congratulations to them in Charlotte, and thank you as usual to the MEDC for their assistance, as well as BCI from LCC and Capital Area Michigan Works. We're going to do a lot more, and I hope make substantial announcements here in the next months to come along. But while we're doing all that, we also have initiatives like Ag Tech, but also MedTech, and you're going to hear a lot about that today. We have enormous potential as a region to be one of the very major MedTech hubs in the United States, if not the world. I also just want to mention quickly, I look forward to seeing all of our board members from LEAP at our LEAP board meeting, which will be on February 9th from 3:30 to 5 o'clock. And of course, we do all that virtual Zoom, but you're going to hear a great presentation from the Michigan Economic Development Corporation about their newly amended strategic plan, as well as other very exciting news from LEAP. So we look forward to seeing all 64 of our LEAP members there.
Let's chat about LEAP's MedTech Advisory Committee. Can you guys tell me a little bit more about kind of why the advisory committee was formed, what that process was, and maybe some of our regional partners?
Yeah, so we've been spending the last couple of years really focusing a lot on this medical technology space, MedTech. And the reason for that is that over the last 10 years, the industry, particularly looking at pharmaceutical and medical device manufacturing, has doubled in our region. So it's been really a bright spot within manufacturing when you've seen other pieces of that sector either kind of stable or declining. So it's an opportunity for growth. And we see that being true for decades to come as well. And we've seen that nationally and at the international level. So that's kind of the reason for focusing on it. It's a big contributor to industry growth and really high paying jobs and a way for us to diversify our manufacturing sector. So we created an advisory group made up of all of those manufacturers that create goods and products and technologies for the healthcare industry. But we also knew that we had to connect dots and we had to get them connected to our local health systems. So Sparrow and McLaren are part of that, as well as the manufacturers like Emergent, Neogen, Niowave, Bionetics, Orchid, companies like that, as well as the talent connectivity. So getting Michigan State University involved, both in terms of their health sciences folks, their researchers, their tech commercialization. So there's a lot of different pieces in play, and this advisory group is really meant to bring all those stakeholders together and also bring in local government leaders to kind of understand the import of this and help shape priorities and connect and create a network in an area that, there's a lot of really strong assets, but they were never really connected before. So we created that early last year, just before COVID came upon us, and obviously changed things.
Yeah, so this momentum within this particular sector was already here, and it ended up being clearly quite timely. So in terms of reflecting back on some of the successes and work from 2020, can we talk a little bit about that, and maybe specifically about some of the impact, well, probably the pretty significant impact that the COVID crisis had on the direction that you guys took getting this off the ground?
Yeah, so the general approach to COVID, so we have two co-chairs of our MedTech advisory group, Dr. Norm Beauchamp and Mike Zamira. Norm is the lead for the executive vice president of health sciences with Michigan State University, and then Norm is the president of NIOWave, a medical isotope manufacturing company here in Lansing. And Norm was the first to reach out. Really, I think it was the week of the initial restrictions. And really when the pandemic was rearing its head in the United States, he got with us and said, hey, this group could really be an important platform for us to have kind of real-time conversations with the health system leaders to figure out how we can help them with their supply chains. We know the personal protective equipment, PPE, is really a big issue right now, getting N95 masks and other gloves and face shields and different things. How can we source those things locally? So that was really, we kind of had this mobilization effort, and LEAP and our advisory group kind of led the way on putting together a matchmaking of, we have these things or these capabilities or these materials, what are the needs and how can we match make there? So we made about 30 supplier connections just from March through May related to that. So we were able to kind of help the health systems get connected to local companies that could support them with the things they need.
Yeah, awesome. And kind of looking ahead into 2021, obviously, COVID response will continue to be probably a major strategy point for this group and just regionally in general. What are some things that you're excited about going forward, both in continuing COVID response, hopefully getting to a little bit more of a sense of normalcy, kind of the other side of this crisis, and what comes next?
So I'll speak on that. When it comes to in 2021, a lot of that framework we did in 2020 will really be built upon. The community partners and collaborations are there. The first part, as Keith mentioned, just getting everybody in the same room and understanding how we all play in this space together is paramount. Is the first start to really develop and build. Within this year, we have a number of opportunities that present themselves, one being an EDA grant that will take place, that we're in the, finalizing the details of that coming place. We've been already selected, but finalizing the exact admin pieces. But that will both help us highlight our region as a cluster when it comes into medtech development, and also spur innovation with our local partners in the medtech space as well. When I say spur innovation, we're thinking about using our health systems and those manufacturers and service providers Keith mentioned earlier to really be a springboard for new startup companies and new technologies that can really connect and help fill out the ecosystem within our current space. We think of new technologies, whether it's for related to COVID exactly, or other ways to improve health and well-being and service of the patient, of the health system, or the myriad of ways that impacts our well-being throughout that cycle. And so 2021 should be real exciting for that. It's we see this really taking place late spring, early summer in that regards, but it's a community effort and it really shows how our tagline, Stronger Together, it really ties in that, because all these people and all these organizations are crucial to have this type of work.
Awesome. It's kind of exciting to see the marriage between a really critical moment for our region, for our state, for the world, kind of fit very nicely into what was already an existing strategic priority. Is there anything else you guys would like our listeners to know about MedTech here in the region, about the advisory committee, or just about the work that we're doing in general?
I would say I'm really excited by the ongoing project work we're doing in this space too. You really can't divulge too many details at this point, but we're working with about half a dozen very notable medtech companies that are already here in our region, and we have another 3 to 6 really prominent prospective projects from out of market in business attraction projects. So that's another, our pipeline is also kind of just reinforcing why we need to focus on this and that the opportunity is really there. So we expect a lot of continued growth, and we think the MedTech Advisory Group, the EDA grant that Tony talked about, will really help us elevate ourselves, our brand, and the connectivity of all the pieces of the puzzle to make us really one of the great MedTech communities in the country.
And to add on to Keith there, not just our collaboration we have in the Lansing region, we know that we can use this new program, this MedTech Innovation Lab program we'll be launching here, to really grow those pipelines from other communities to help really benefit our local healthcare systems and other MedTech related corporations as well. We know that Detroit has a large cluster and Grand Rapids in some capacity as well. And this further aligns us across on both sides of Michigan to really pull talent, resources, and great minds and innovation to our local economy.
Awesome. Well, I know I personally am super excited to see how this becomes just another piece of making our region stronger and more attractive. Thank you so much for taking some time to chat with us.
Thanks,
Thank you, Katlyn.
I am here with Kirk Ray, the president and CEO of McLaren Greater Lansing. To start off, tell us a little bit about your background and your time with McLaren.
Yeah, thank you very much for having me this morning. I really appreciate the opportunity. I've been with McLaren for almost 3 years now here in Lansing. Prior to that, I was with Community Health Systems, which was based out of Nashville, Tennessee. It was the largest hospital operator in the country. And at one time over the last probably 6 to 7 years, I had operational responsibilities for hospitals in the Southeast, over 40 different healthcare markets before coming up here. And what a great opportunity this was to be able to come here and build new.
Awesome. What brought you to Lansing? Was it specifically McLaren, or do you have ties to the area?
No, it was the opportunity with McLaren, and the bricks and mortar piece was really exciting. It's the biggest investment that McLaren's ever made in any one market. But for me, it was about really developing the collaboration with Michigan State, and then building key service lines within the hospital itself, other than just the bricks and mortar. That was the really exciting part for me, was to be able to take something from scratch, really.
Awesome. So the past year has obviously been a unique time for healthcare in particular. How has McLaren continued to serve as a regional healthcare leader in response to COVID-19 specifically?
I think McLaren, like all other health systems, has had to pivot during this pandemic, and this has been challenging for everybody. But I think from a responsibility to the community and the patients that we serve, have done a phenomenal job in. I've like I said, I've been doing this 30 years, but I've not been a PPE supply distributor expert. I've not had to work on a mass vaccine distribution model up until this year. And so, and doing that in conjunction with being able to take care of patients like you do every day. When someone asked me at the outset of this, what are you going to do? And I said, well, we're not going to do anything differently, because patients with disease processes walk through our doors every day. We're a hospital. Did we have to change some things? Absolutely. Everything from social distancing to plexiglass in all of our common waiting areas, to repeated cleanings in our common areas, screeners at all of our entrances. These were not in place a year ago. And so a lot of work's had to be done to create a safer environment for patients to come access healthcare. And we had to get vaccines out over the last few weeks. We're probably near 4,000 at this point with just our employees and associated physicians. And so a lot of work, a lot of pivoting is the key word that's been taking place during this. And we're not unique to that.
Yeah, so in addition to helping lead Greater Lansing's pandemic response, you talked in the previous question about the excitement of the brick and mortar opportunities at McLaren. You guys are also in the midst of a really exciting expansion project. Tell us more about that and what it means for McLaren and the region.
Yeah, I think, as I mentioned earlier, it's the largest investment in McLaren history. It's a $600 million investment in this region. It's taking both of our existing campuses right now and combining those into one replacement hospital, state of the art, designed by physicians, clinicians, and support staff. It'll encompass currently a 240 bed hospital, in addition to a new medical services building, our outpatient care center, and our Carmanos Cancer Center, which is also part of that. So in all, over 750,000 square feet of new construction on 53 acres just on the south end of Michigan State's campus. It's been exciting just to see all of the general contractors, subcontractors working on this project. Thousands of folks who wouldn't have had a job otherwise that are here in Lansing, staying and filling up hotels, getting takeout responsibly from restaurants during the pandemic. But it's put a lot of people to work here in this region, just putting this thing together.
Yeah, well, and that's one of our favorite things here at LEAP is bringing new people and getting them to stay in the region. Is there any message you have for the community when it comes to continuing to manage their healthcare and the response to the pandemic?
Yeah, it's scary. You read a report from the CDC indicating that 40% of folks are staying home. They're not accessing healthcare. And, if you use our emergency room as a litmus test, the patients that are showing up are very, very sick. They've held off healthcare for months. And now we're seeing a higher propensity for patients to get admitted to the hospital than we were before. The walk-in type of patient we're not seeing. Those are the folks that are holding screenings off. I would say don't wait on healthcare. Other disease processes are going to continue along with COVID, and we would recommend highly that if you have something that you're holding off on, go see your primary care physician, or if it's an acute situation, come to the emergency room. And I would recommend McLaren.
So basically, if there's any space that's going to be, as safe as it could be going out into public, your healthcare systems, you can probably trust to be doing the right things to keep you safe.
Yeah, absolutely. I mean, it's a requirement. Like I said before a pandemic, we see patients with disease processes, and we have universal precautions that we put in order. We've actually just ramped it up even more since this came out. But yeah, you're going to have one of the safest environments.
Awesome. Well, thank you so much for taking some time to chat with us about the pandemic, about McLaren. We're super excited to see continued success with your expansion and to continue partnering with you on our regional healthcare response to the pandemic and whatever comes next. So I am here with Joe Ruth, Executive Vice President and Chief Operating Officer of Sparrow. To start out, tell us a little bit about your background and your time with Sparrow.
I'm coming up on my 14th anniversary with Sparrow. Lansing is my second home. Grew up in Saginaw, went to Michigan State, and I've been back and forth between Lansing and Saginaw my entire life. It has been an incredible experience, and this has been an interesting time to be here as a part of Sparrow.
I believe that. The past year has obviously been a unique time for healthcare in particular. How has Sparrow continued to serve as a regional healthcare leader in response to COVID-19?
It has been an incredible journey, and actually one that I think bodes well for the future. As the pandemic hit in March and April, we literally shut things down in order to concentrate on what we didn't know was coming. We innovated in a moment's notice of standing up the now nationally known old Sears Tire Center for COVID testing, where we're at about 370,000 tests to date, which I think has been a real benefit to the community, right? We are finding out who might have been exposed. Hopefully they're isolating themselves and stopping the spread. And in recent weeks, we've now pivoted and created 2 lanes of vaccination, sometimes 3, I believe now, lanes at that same facility, getting cars in and out. And from what I understand, 40 seconds from the time they hit the door to getting their shot. Through this whole thing, our hats are off to our frontline caregivers. They have been asked to do extraordinary things, change the way we do things, treat patients differently at a moment's notice. And it's been a cycle of learning and really an era of innovation for all of our organization. We've even bought a 3D printer to be able to print our own nasal swabs when we thought that the supply chain wouldn't be able to keep up with that demand. And so there's story after story across Sparrow, not only here in Lansing, but across all of our community hospitals in terms of stepping up and meeting the needs of the community.
Yeah, so prior to our shift to working from home last March here at Leap, I used to actually produce a different video series called the Leap Weekly. And one of the last videos I actually remember filming was with the team at Sparrow about some of the innovations that you guys were finding with cancer treatment. So in addition to this massive pivot to meet the current crisis, what are some other things Sparrow has been working on or that are maybe on the horizon?
That is again another strength of our organization, that while many of us have pivoted and dedicated ourselves to fighting this virus, there's an equal amount of folks that have their eye on the future. We have been very focused on creating more primary care access. It's been a deficit in this community for a long time, and Lansing and Sparrow are huge attractors for physicians joining our Sparrow Medical Group. And so that has been one area. And within that group, again, under the shadow of the pandemic, we've moved a significant portion of our visits to a virtual platform, video visits with your physician, so you don't have to go in. We started from basically zero. We went up to almost 80% of our interactions, be it telephonic or video. And we believe that the future will be at least a good 20-25% of those interactions can be handled just like we're talking here today. And so all of that in the moment's notice. We continue to look to enhance our services. We have not had the type of ambulatory surgery platform that we've wanted, and we have plans to hopefully break ground this time, sometime in the spring, mid-year, and upgrade those facilities, as most surgeries now are moving from an inpatient, 3-4 day stay to something that happens in the course of a day or so. It's just incredible the amount of innovation and technology that's available to us.
Yeah, no, it definitely is. So is there any message that you have for our community when it comes to the pandemic?
We have a very specific mantra around Sparrow, and I'd be remiss if I didn't say it. We really want people to stay safe, stay vigilant throughout all of this. It's easy to let your guard down and say, maybe it's past. And every time we do that, we see a spike. And so we want to remind everybody, wear a mask and save a life. It's incredibly important. Our numbers are down. Hopefully we're going to restore some semblance of normalcy. But we've got a long ways to go. And if people just stay focused, I think we'll be just fine.
Awesome. Well, thank you for taking some time to chat with us. And thank you for all the work that you've done to continue to keep our community safe and healthy.
Thank you.
Thanks so much for watching. We'll see you here next month for the next episode of LEAP's Regional Resiliency Report.